So I knock, and she has to allow me to come in. So I've knocked, and she said, "Come on in." So I'm entering. Hi, Miss Jones. I'm Mrs. Davis. I'm your nurse for today. I'm going to be changing the dressing. Is that okay with you? She says yes. Do you need anything for pain? She says yes. So I'm going to go and get your pain medication. I'm going to give you some Lortab, and then I'll come back 30 minutes to an hour after that. So that has already passed that time frame. So I'm back. Miss Jones, is that pain relieved? She says yes. I'm going to go ahead and change your dressing today, okay? I'll check your orders, and doctor wants me to do that every 4 hours, okay? So I've gathered my supplies, and my supplies include a dressing change kit. They come packaged differently, and this one does not include Q-tips, so I've included some Q-tips here. I have a device to measure the wound. I have a chuck that I'm going to put down on the table. After I've cleaned my table off, I have something to clean the table. And then I have hand sanitizer. Now I wash my hands before coming into the room because I know I'm going to be dealing with body secretions, so I've already washed. So inside the room, I'm going to sanitize. I'll get all my fingers in between my fingers. And then I'm going to apply my gloves. I'm going to elevate the bed to a working position so it's comfortable for me and the patient. And so I've done that. I'm going to actually lay it up some too. I'm going to let the head of the bed down if she can tolerate it. Can you tolerate me letting your head down just a little bit? She says yes. I'm going to position you over on your tummy so that I can get to your wound, okay? And she said okay to that. So I'll position the patient to her bottom, and this is her bottom faced up. So I'm going to go ahead and remove your dressing, okay? So I'm going to loosen the edges of the tape with either alcohol or an adhesive remover, because usually who has wounds are geriatric patients, and so I don't want to injure the skin further. So I'm going to roll the dressing, now that I've done that, away from the wound. Looking at, there's no external drainage on this dressing, but internally as I roll, I see serous sanguinous, and some sanguinous drainage. If I had an extra pair of forceps, I wouldn't dip my fingers out. Actually, use forceps, but I'm just going to get a little edge of these dressings. Okay. In this particular wound, I see some healthy pink tissue. I see some slushy tissue. I see some necrotic tissue at the bottom edge of it. And I've noticed that it's tunneling at the top and the bottom. So I'm going to measure. I'm going to measure externally first. Length and width. Starting up one top, and that's about a 10 by 7 inch. And then I'm going to use, I didn't touch down with that, so I'm going to use my Q-tips. And I was change the Q-tip each time that I touch in. So I'm going to measure the tunneling at the top. And I'm going to measure without touching down, and I'm measuring in inches. That's about 1 inch. Then I'm going, that's a different Q-tip. I'm going to measure the bottom. And I'm going to measure. And then I'm going to measure the depth. And that's about a 2. I also noticed that there's some bony tissue protruding in the center of that incision or wound. It's a wound. Are you okay, Mrs. Jones? And she says yes. Just because I touch down, sometimes it's painful. So this time I'm going to go ahead and I'm going to clean the wound. Just for check-off purposes, we'll not clean the wound this semester. So I have cleaned the wound with whatever the physician has ordered it to be cleaned with. So I've cleaned the wound with peroxide or whatever he's ordered. At this point, I'm ready to start my dressing change. So I'm going to remove those gloves. I'm going to wash again just because I've been with blood and body secretions. I will wash again, and then I'm going to hand sanitize again. Wash, sanitize. I'm going to remove everything from my table so that I can set up my sterile field. And if I needed to clean my bedside table again, I would clean my bedside table again. Now this particular kit does not come with forceps included, and they all come set up differently. I only have a 1-inch border that I can touch inside my sterile fill, so I'm gonna actually take that fill. I'm gonna apply it to my bedside table. Now this particular pad is not considered a sterile. I'm just going to use it as a barrier between my kit and my table, bedside table. All right. So I'm going to gather my sterile gloves. And these gloves don't come set up, and it just depends on the manufacturer. It's usually away from you, and then the edges here, and then towards you when you're talking about sterile gloves. But these don't come set up that way, so I'm going to work with what I have. Either your dominant hand goes on first. I can only touch the border there. I don't know if I'm going to get these teeny ones on though. Yeah. Yeah. These are tiny. If I get my fingers in that Miss Shoe, bring me that 8 right there. I'm not gonna get my hands in it. These are too small. Yeah. They're sitting right here on the table. Thank you. Now, away from me. Force. And then out. So dominant hand first. Sterile to sterile. I'm going to moisten my dressing, whatever solution the physician has ordered. And today it's just normal saline. I'm going to dampen my dressing but not saturate my dressing. I don't need this anymore, so I'm going to put on. There's scissors in this one. Yes, there are. If my dressing was saturated, I simply release some of the moisture of the air into my fill. And then I would use my forceps. I would start in the center here, trying not to allow my dressing to touch outside of the wound. And we don't want to pack it. And we don't want it to be too moist. That breaks the wound down further. I'm going to cover. Blue side up. This blueberry indicates when that dressing is wet and saturated, so that's an indicator. I'm simply taping down, securing my dressing. There's not going to be enough tape in this little kit, I don't think. Let's see. At this point, I would date, apply my initials, and the time that I changed the dressing so the next nurse will know when I actually perform that procedure. Some of the kits come with a manufactured that I can initial and date and label, and then actually put in, some don't, and we just use a ink pen or marker to address that. All right, Miss Jones, are you in any pain? I've completed your dressing change. She says no. I'm gonna side roll back up. I'm gonna reposition her, elevate her head, and then I'm gonna lower my bed for safety. I'm gonna wash my hands. I'm gonna document the procedure and then follow up as indicated. Let's cover you back up. Alrighty.